Now, all of a sudden, he is being tough on China. He's making sure, and now he's being soft on his xenophobia in the past. So I just can't figure the guy. I don't know, it's like watching a yo-yo.
The Democratic frontrunner Joe Biden says he wants the president to, quote, stop talking and leave the medical advice to the experts. Here's more of what the president had to say about his push to get our country back to work.
When you talk about areas that you could open up, what specifically are you looking at? What states? Are you talking about out west?
Well, you can
Midwest,
talk about
South? Where
the
exactly?
Farm Belt. Take a look at the Farm Belt. Take a look at areas out west. Look at big sections of Texas. I was talking to the great governor of Texas. They've done a fantastic job out there, but they have very big sections of Texas where, you know, it's like numerous states, frankly. But we can have large sections of, if we want to do it that way, we can have large sections of the country open.
Well, let's talk about it with a professional, Dr. Anne Rimoin, a professor of epidemiology at the UCLA Fielding School of Public Health and Infectious Disease Division of the Geffen School of Medicine. Also happens to be director of the UCLA Center for Global and Immigrant Health, who specializes in emerging infectious diseases. Doc, thanks for coming back on. I need to get your read on this. Do you really see us clearing, giving the move around permission to large sections of our country? Do you really see us trying to get back on our feet as early as Easter Sunday morning? And what's the better chance? Are we going to have packed churches or packed hospitals on Easter Sunday?
I think this is a very dangerous strategy, and that we're going to be losing any ground that we will have gained at a critical moment by keeping people in place. You know, any country that has had any measure of success in being able to slow the spread of this virus has taken very strong measures of restricting social, having social distancing and restricting movement of people. We here in the United States have no idea how many cases we have right now because the testing has failed so, has been so far behind, and we are most likely at the worst part of the curve. So this is a very dangerous idea, and I think that anybody that is suggesting that we're going to be able to relax when we should be tightening restrictions is not thinking about what the impact will be on hospitals, on healthcare workers who are already beleaguered, and frankly going to be reaching a breaking point if we do not continue to to keep social distance measures in place and more.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.